Now, the ravages of the Delta variant of COVID-19 has been a major source of public concern as cases consistently rise across the world. First detected in India, the Delta variant began to spread more rapidly with the attendant panic across the middle of June. In response, the Nigerian federal and state governments have initiated several steps to arrest this exponential spread across the country. Akwa Ibom State in Nigeria's south has been one of the most proactive in this collective intervention. And to have a quick discussion around all of this, we're now being joined by the Chairman, COVID-19 Management and Secretary to Akwa Ibom State, Government Dr. Emmanuel Ekuwem. Good to have you join us on Newsday, Doctor. Now, if I may start...
Thank you. Good day, my sister.
Thank you.
Thank
you. Now, how does your state, Akwa Ibom, manage to curtail the new Delta variant compared to the first wave of the COVID-19 pandemic?
Yeah, thank you. The first step is public enlightenment and public awareness. And we put in place the Emergency Operations Center, the Isolation Center, that was declared open or commissioned by the governor of the state. Then the contact tracing, a large number of tests to be sure that our citizens were testing negative. And then making sure that they were treated and they were in hospitals and in isolation centers. We needed to isolate them, and some were isolated at home, and so were very enlightened as far as healthcare is concerned. So indeed, so the same steps that we took and the content of what we did last year, we have reactivated all those. One, public enlightenment and public campaign to all the local government areas of Akwa Ibom State. Then in churches and places of worship, in hotels around the cities, we have discouraged gathering of people in large number. Last year, the governor directed that we shouldn't be more than 30 persons in the church. And in the funeral service, all funeral services were and are now conducted in open spaces, in primary school compounds, or football fields and secondary schools, and no more in churches, in order to ensure social distancing. So those are the steps we've taken. Fortunately, the first batch of AstraZeneca were carried out. We did carry out the vaccination, and then we ran short of the stock of the AstraZeneca. We now have Moderna, about 60,000 that have arrived, and last week ends vaccination activities in the state. So all citizens are urged to be sensitive to the search of this pestilence, and then to do all the needful steps or carry out all these things we did in the first wave. Social distancing, wearing a face mask, washing your hands with running water, making sure that if your temperature were to increase beyond 37, 38 degrees centigrade, you needed to take yourself or find somebody to escort you to the nearest available medical center. And then if you were losing your sense of smell, if you were coughing repeatedly, if you were sneezing quite repeatedly, you needed to also report to the nearest medical facility. All our hospitals, as you know, even before COVID-19, equipped with the general hospitals, with ventilators, we have about 19. And as you also know, on May 29, marking our Democracy Day, and then the second year anniversary of the governor in the second term, we commissioned a 40,000 capacity oxygen plant, medical gas plant, in the same isolation center that can take up to about 300 patients. But the oxygen, the 4,000 capacity means it can disperse or dispense or give oxygen to the needed, about 4,000 in capacity. So we are fully equipped, and we, as I said, we have reactivated all the schemes that we put in place during the first wave of the pandemic. Thank you.
Doctor, in rural communities with the lower vaccination rates, particularly areas with limited access to care, what are the measures that your state is putting into place to encourage these people to get some testing?
As I said, the moment you exhibit, first, if you are exhibiting any of the symptoms, and if you were in contact with somebody that was tested positive, we do extensive contact tracing. We stop at no point. until we get to the total number of persons come in contact with you, or they are going to come in contact with, or that you visited, or that had visited you. And then the vaccination centers are very clearly designated. And then the test always continuously. What's quite a good number of times that you see that increase in number is that after the first test and you turn positive, you are isolated. If you are quite educated and exposed, and you are medically savvy enough to isolate yourself and put yourself in self-quarantine, then you are managed and treated from home. Then those who are not so experienced and exposed and quite disciplined to do that, they are taken to the isolation center, and then we do a second test, and sometimes a second test yield turns out to be positive. So when you see that number, maybe the same persons who tested positive twice, there's somebody who tested positive 3 times. All those are recorded as numbers from Akwa Ibom State. So we are quite serious about that. And then from the emergency operation center, we monitor what is happening in the 368 villages. We have about 3,000 villages. And we have designated DACAD ambassadors and local health professionals or healthcare workers who report any evidence or any indication of anybody suffering from any of this. Even if the person says it's malaria or whatever, or typhoid, we needed to make sure that we eliminate the possibility of malaria or typhoid and carry out the PCR test on our citizens. Also, a good number of citizens from nearby states are also coming to Akwa Ibom State because of the medical facilities in all the 12 general hospitals and isolation centers, and then Ibom multi-specialty hospital. So a good number come to Akwa Ibom State. We don't turn them back, because at the end of the day, if we turn them away, they keep on mixing because of the porosity. I won't call it porosity of border, movement of human beings. These are all Nigerian citizens. Then you run the risk of jeopardizing public health. So that is allowed. They're all Nigerians, and we take care of whoever comes into Akwa Ibom State that needs attention. So testing is ongoing, repeatedly, and contact tracing is important, indispensably important. Because if you do not do that, then even those who, even when you are asymptomatic, in other words, they're not showing any symptoms at all, and we've tested you to be positive, we isolate you. If you are mature enough to discipline yourself. Otherwise, you stay in home isolation, or we put you in quarantine in the isolation center. So our tests are ongoing, and we're quite serious about it. We have church monitoring teams in the 3 senatorial districts.
Thank you.
Inaugurated.
Thank you so much for your time, and we wish you all the best with your vaccination campaign in Akwa Ibom State.